Pharmacists can include fall screening in any pharmacy setting. Review the patient profile and medication history to identify risk factors. Notice if a patient has trouble standing up, has problems with mobility, or uses an assistive device. Take the time to ask your patient about their risk factors. Specifically, screen for a history of falls and conditions or medications that increase risk of falls. When screening for a history of falls, ask your patients, have you fallen in the past year? Do you feel unsteady when standing or walking? Do you worry about falling? If your patient answers yes to any of the 3 screening questions, they're at increased risk of falling and need further assessment.
The tools and questions we use for fall screening are the 3 questions. The first question, have you had a fall in the past year? The second question, do you worry about falling? And the third question, do you feel unsteady? And then in geriatrics clinic, we use the TUG test, the timed up and go test, as well as we have the stay independent self-assessment.
Another screening tool is the Stay Independent Brochure, a validated fall risk self-assessment. A patient can fill it out at home or while they're waiting to see a pharmacist, and you can review it together. The brochure highlights the patient's specific risk factors and helps guide your discussion. Also consider whether your patients have health conditions which can lead to balance problems, unsteadiness, or tripping. These can include conditions like cardiovascular disease, stroke, and arthritis.
Some of the top health conditions that I associate with fall risk would be hypotension, would be patients who have diabetes, patients who have cognitive impairment, and then, of course, the obvious patients who have gait abnormalities.
In the older adult population, there are many comorbidities that increase risk for falls, and often what I see is that patients will have low blood pressure or hypotension. They may have low blood sugar or hypoglycemia, and both of those can contribute to falls. I also see patients who get up in the middle of the night to use the restroom, or they may have urinary incontinence, and that increases their risk of falling, especially at night. And then finally, movement disorders or mobility disorders are frequently a cause of falls in our older adult patients.
Finally, identify medications that increase fall risk.
There are a lot of medications that increase risk of falls, but what I see the top medications being typically are benzodiazepines, lorazepam, diazepam, alprazolam, for example. I also see patients taking insomnia medications, so the Z drugs, zolpidem, azopiclone, zaleplon. Those medications often are ones that the patient feels like they really need, but definitely increase fall risk.
Medications linked to falls include anticonvulsants, TCA and SSRI antidepressants, antipsychotics, benzodiazepines, opioids, and sedative hypnotics. Remember, any prescription, over-the-counter medication, or supplement that has anticholinergic side effects increases risk. These effects include blurred vision, drowsiness, sedation, dizziness, orthostatic hypotension, or confusion. Drugs like antihistamines, medications affecting blood pressure, muscle relaxants, and sleep aids should be closely assessed. Other common medications such as NSAIDs and proton pump inhibitors may be used regularly by older adults, but may not be appropriate for long-term use. For a quick reference sheet, refer to CDC's Medications Linked to Falls. For specific guidance, refer to the Beers criteria from the American Geriatrics Society for a list of medications that should be avoided or carefully considered in older adults.
Fall risk is multifactorial, and in our older adults in the United States, polypharmacy is often a huge concern. So as a pharmacist, I am really focused on trying to reduce drug burden in my patients, and I think pharmacists can play a huge role in helping prevent falls in older adults by reviewing medications and making sure that the patient's taking medications appropriately and that they're safe for that patient.
Many older adults suffer from more than one health condition or take multiple medications, making their risk of falling even greater. Even a fear of falling can increase risk. STEADI includes a fall risk checklist and the Risk Factors for Falls worksheet as additional resources that can be useful for your initial screening and risk factor assessment.